Well, good evening, everyone. It's good to see you guys, even though I'm saying everyone's names. It's all right. So I'd like to welcome Amy this evening for our pelvic floor chat. I will let her do a more formal introduction of herself. But we were excited to connect and get this talk to you all. And then if you're watching this after the fact, I hope you enjoy it. So Amy, I'll let you take over and get to it.
All right. Yep. Thank you. I'm Amy. I'm a pelvic floor physical therapist. Been a PT for almost 8 years now and specializing in pelvic health for six. So I have a little PowerPoint slide or presentation that I will share with you guys. Let me just share my screen. Don't want that. You guys seeing this okay? Good. Okay.
Yep, I can see it.
How about that? Good. Okay. All right. So I have a particular interest in endurance athletes, which probably most of you guys feel that way as well. So I created this presentation about pelvic floor and a specific interest in the endurance athletes. So I have my own business that's at the bottom there, Ascension Pelvic Health and Orthopedics, which I'll get into a little bit more. Yeah, a little bit about me. So like I said, I'm the owner of Ascension Pelvic Health and Orthopedics. I'm in Montclair, New Jersey. These are some pictures of me, my husband, my kids. I have two daughters, 5 and 3. And I do in-person physical therapy and also virtual wellness coaching. So any of you guys that are out of state, it wouldn't necessarily be like PT services, but if you need general guidance, or like wellness, just kind of like working out with your pelvic floor in mind, I can do that. I generally do running races, triathlons. I was a college tennis player, and after I graduated, I felt that competitive edge still. Um, so I needed to do something. So naturally, torturing myself in endurance sports was the logical choice. Like I said, been specializing in pelvic health for 6 years. Particular passion in postpartum, like return to run, return to exercise. That's like my favorite thing to do. So, what is the pelvic floor? I assume most of you here because you've maybe heard of the pelvic floor, but you don't really know much about it, or you have heard of it and want to know more about it. But it's a group of muscles that lie at the base of your pelvis, and they're really important muscles because they're responsible for bowel, bladder, sexual function. They're going to contract and relax like all other muscles. So whenever we urinate, have a bowel movement, the muscles are going to relax. Whenever we have to hold in urine or stool, they're going to contract. They're also going to contract whenever we have to lift something heavy or even like reach our arm up above our head. So it's working kind of all the time without us really knowing. So connecting with your breath is really important. The pelvic floor muscles are working with our deep core. And I'm going to move this little, sorry, that was like in my way. You guys probably can't see that though. Um, so connecting with your breath, yeah, the pelvic floor muscles are working closely with our breath. So kind of how I mentioned before, as we inhale, you're going to have that relaxation of the pelvic floor muscles. As we exhale, you're going to have the contraction of the pelvic floor muscles. So particularly in running, our pelvic floor muscles are critical in the running cycle because they play a role in the core for stability. So if your pelvic floor muscles are lacking, you're going to be compensating elsewhere, and that can lead to actually injuries. So a lot of us are going to have um, very like repetitive running, especially if we're training for like a big race coming up. So if you can imagine, you're lacking that stability on every single step of every single run. That's a lot of repetition that you're putting like strain on your body, so that can lead to different kinds of injuries. Whenever you land on one leg, you're accepting up to 3 times your body weight, so that's like pretty significant strain to do over and over again. Ideally, the pelvic floor muscles are going to act like a trampoline. So they're going to absorb that force and then quickly bounce back up. A lot of times, like with stress incontinence, whenever you have leakage with running, the bouncing back up part is what's lacking. So we try to, in pelvic floor PT, we'll work on the coordination and the quick contractions of those muscles. So for cycling, which most or all of you guys are. Obviously, whenever you're sitting on the saddle for a long period of time, you're sitting right on pelvic floor muscles, right? Which is why it's important to get a professional fitting just to make sure that that saddle is going to work for you, especially if you're going to be on it for a long time. Um, Everyone's pelvis is kind of different widths, different sizes, so it's important to really get like proper measurements. It's also going to be the muscles are going to be active whenever you're cycling to like kind of hold that position in place for a long period of time, and whenever you're maintaining effort or like climbing up a hill or anything like that. So, what is the Kegel? So, again, all muscles are going to contract and relax, and a Kegel is just a contraction of the pelvic floor muscles. So, I think I mentioned this before, but whenever you urinate, have bowel movement, those pelvic floor muscles need to relax. Whenever we're holding that in, they need to contract. And these are common symptoms of pelvic floor dysfunction. So, any leakage, urgency, frequency, constipation, painful intercourse, low back pain, hip pain, pelvic pain, or heaviness. So a lot of these symptoms are pretty common, especially postpartum, but we like to say common but not normal. So meaning they happen a lot, but there's something that you can do about it. So how are we going to improve our pelvic floor awareness? That's like the main goal of today's talk. So these are some common bladder irritants. It's a very it's a list that a lot of people love. Like a lot of people love things on this list, like me. I love coffee. I'm addicted to coffee. And these are actual pictures that I took of coffee that I have had. So not that you have to eliminate these things on the list, but just be mindful of if there's a pattern. So like for example, if you have coffee and you notice your pelvic floor symptoms like urgency or frequency increase, then that might be a bladder irritant for you. And you can be I guess, responsive to different things on the list. Like caffeine might be the worst thing for you, whereas like spicy foods don't really bother you. And I'll just run through a list. Caffeine, alcohol, carbonation, spicy foods, acidic foods, citrus, artificial sweeteners, and dairy. And then bladder norms. So a lot of people don't know this, but you should be urinating 5 to 8 times a day, or every 3 to 4 hours. So a lot of those like just in case peas are not very good because you're actually training your bladder that's normal, and then it'll start to be a pattern. So you're like creating that dysfunction actually. And then at night, 0 to 1 time a night. So you don't want to be waking up 3, 4 times a night. Because again, you're gonna cause your bladder to recognize that as a pattern. And then water intake's really important. You want to be drinking about half your body weight in ounces, which is kind of a lot. But hopefully, as endurance athletes, we're drinking water. So these are general pelvic floor mobility exercises. Um, Again, we want the muscles to be able to fully relax and fully contract in order to be fully functional. So the emphasis for those muscles are going to be hip and spine mobility. So cat-cow, child's pose, cobra pose, a lot of like yoga poses are really good for getting the like full expansion or full stretch of those muscles. And then also on the strengthening side, deep core and hip stability are going to be important. So the muscle groups we like to target are the adductors, which that's the inner thighs, glutes. Hopefully we all know what the glutes are because we like to ignore them, especially if, well, I guess cyclists too, but especially runners. Transverse abdominis, that's the deep core, which works really in conjunction with your pelvic floor. Like as that muscle contracts, your pelvic floor is going to contract as well. Then multifidi, that's the little stabilizer muscles right next to your spine. So if you feel your spine and you like rotate, the muscle's going to pop up. Those are those little stability muscles that we want to focus on. And then generally, to help your pelvic floor, you want to exhale with the effort. So let's say you lift a heavy bag of groceries, you want to exhale as you lift it up. And these are some really shocking statistics that are really sad, but we're working to hopefully change these. 30 to 40% of female runners experience urinary incontinence. And a lot of times they're told that that's normal, by their doctor or by TV commercials or whatever. But again, there's something that we can do about it. Only 17% of the postpartum population receive information about their pelvic floor from their provider. So that's really not a lot at all. It should be 100%. Because even if you have a vaginal delivery or a C-section, those pelvic floor muscles were still under strain throughout the whole 9 months of the pregnancy, just holding the baby in place, right? Like that's a lot of strain on those muscles. So if you had a knee surgery, you'd go to PT right away, right after, right? But not in the postpartum population, unfortunately. And then 17 to 30% of people perform Kegels correctly. So if you're performing Kegels, and again, that's that pelvic floor muscle contraction, and you're performing them incorrectly, let's say you're doing that repetitively, then again, you're feeding that dysfunction of the muscles. And then standard of care. So it's actually standard of care in Europe and Canada to see a pelvic PT for at least one visit after giving birth. I believe the average in Europe and Canada is 10 visits. And then it's important because we can assess the muscle function and the readiness for their return to exercise. So common but not normal, again, that's that saying I was talking about. 1 in 3 women experience pelvic floor dysfunction at any stage in life. They tend to worsen during perimenopause, menopause, or pregnancy postpartum. And then the pelvic floor symptoms are super complex and variable. Everyone can experience different symptoms. Sorry, my daughter's like yelling in the background. But in summary, you should see a pelvic PT to get a personalized plan for you and to really assess those muscles. Okay, any questions? I feel like I flew through that. These are more pictures of my crazy children. So,
Can you go
and
over how to
this
do
is,
the Kegel the right way? You said so many of us don't do them right. Can
yes.
you give us a little
Yeah, let's get back to that. Um, the
lesson?
best way, yeah, the best way is I'll tell people to like roll up a towel and then you can sit on the towel. And then when you inhale, really expand your rib cage, expand your abdomen. You're going to feel hopefully the pelvic floor muscles drop onto the towel. Then as you exhale, you're going to squeeze up and away from the towel. So usually that helps you get like a little bit of feedback. Whenever you see a pelvic floor physical therapist in person, we generally do a pelvic exam. So we're assessing how those muscles are working like in real time. So we'll do a pelvic exam, not quite like the gynecologist. We're really assessing the muscle function versus like the cervix. But whenever we do that, one glove lubricated finger goes in through the vaginal canal, see how you squeeze, see how you relax. We see if there's any tightness or tenderness, and then we go from there based on what we find. So that's one way, like if someone's doing the Kegel incorrectly, then we can kind of coach them through it in real time.
Thank you.
Is there like a recommended like postpartum where you would say like is the 10 sessions good? I'm sure it's like very person dependent too. But is there like, hey, for this many months you should be engaged in pelvic floor PT?
Um, I usually tell people plan on like 3 months or so. But it kind of depends on what the person's trying to go back to. Like if they're not running or going back to like any strenuous type of exercise or anything like that, and like let's say their pregnancy was super smooth, their delivery was super smooth, and they're like able to engage their muscles, and I might see them only a few visits and then send them home with like exercises, that kind of thing. But the national average, I believe, is 12 to 15 visits for like all physical therapy.
Hmm.
So, and generally, and at least in my clinic, we're doing once a week,
Yep.
or even once every other week. So,
Can you
and
cover the breathing for the Kegel exercise again? Which way when you inhale versus exhale?
yeah, so whenever you inhale, you're going to expand your rib cage. So you want to inhale, fill your abdomen with air, right? That's when the pelvic floor muscles are going to relax, lengthen. When we exhale, your belly button is going to come in towards your spine. You're going to lift the pelvic floor muscles like up towards your head if you're in a sitting position like I am. It sounds like the opposite of what you would think, because we, as women, I think, have been um, taught to like suck in, right? But that's actually like really dysfunctional for your pelvic floor because your diaphragm is not expanding all the way if you're always like sucking in. But that's a big part of what we do as well, especially initially, is really trying to like reteach the breathing mechanics.
Yeah, that's definitely the case here. And that's why I asked you to repeat it because I was like, wait, no, that's backward. I must have
Yeah, you
heard
could
wrong.
also no, everyone says that. You could also like put your hands like on your ribs. Sorry, you probably can't see me. You put your hands like on your ribs, and then when you inhale, you want to feel that like expansion. Exhale, bring it together, or even on your abdomen too. That's like a way that people can give themselves feedback.
So when you were talking about the national average and everything like that, for public pelvic floor PT, if you have an issue, is it the same average or could it be longer?
It could be longer. Like I have patients that have had pelvic floor issues for like years, like 20, 30 years type situation. But they just never had heard of pelvic PT or never been recommended to it. So if it's like pretty chronic like that, then that might take a little bit longer. But um, I'd like to see a world where it's normalized to come, like I said, for at least one visit after you give birth, and then you have like a baseline knowledge of what the pelvic floor should be doing and how to engage it, how to relax it, versus like, let's say you give birth and then you go through menopause, I don't know, 30, 35 years later. And then you had like 30, 35 years of dysfunction without really knowing. Because then whenever menopause starts up, then those symptoms that you had that were maybe minor before are going to be exacerbated just because of the hormone changes that you experienced during that time.
Yeah, I'm starting this therapy tomorrow morning, by the way.
Oh, wow. Congrats.
So, I guess congrats. Yeah.
Yeah, I mean, you're taking a very good first step, right? So,
Well, yeah. And the timing of this event was like spot on for me. I was like, yes, this works. I
nice. You
actually
can
get
go
to
into it,
hear all about it. And actually none of my doctors told me about it.
right?
They I heard about this from my regular physical therapist who I started
Hmm.
seeing when I tore my ACL skiing, and then it just kind of went downhill from there. It was just like, injury after injury, SI joint, left shoulder, right shoulder. But I have 3 grown children and I was a triathlete for years and years. And I just, like exactly what you said, like as time went on, and I'm well through menopause at this point. I'm 63 and a half. So now I have these issues and I'm like, and the doctors are saying, oh, well, we can do surgery. I'm like,
Hmm.
no, this is major. Like, I thought it was going to be like, oh, maybe it's just a minor surgery, a little boop, boop, whatever. It's major surgery to your internal
Hmm.
organs,
Yeah.
So I
Well,
said,
good for you.
yeah, absolutely not. And then, I was talking to like I said, my PT guy, and he's the one who told me that a woman in his practice just got certified to do this. So that's who I'm going to
Yeah.
see. So we'll see
Yeah.
what happens.
Yeah, that happens all the time. What kind of surgery, if you don't mind me asking? I mean, you certainly
Yep.
don't have to put all your information out there, but I'd love to
I
like talk through it.
I don't care. thank, thank you for the option to not answer, but yeah, I don't care. Um, So I have a rectocele,
Hmm.
and my OBGYN at my annual visit, when I told him, I'm kind of, I have these weird symptoms, like, and I don't know what it is. And he goes, oh, let me check that out. And so he goes, oh yeah, you have a rectocele. And I'm like, well, what's that? Well, it's this, and this. And he drew me a diagram, and I was like, okay, so what do I do about it? And he goes, well, I can repair it. And I'm
Hmm.
like, okay, yeah, I've heard that before. So, I asked all the right questions. What's it entail? What's the recovery? And he's like, he told me, and he made it out to be not a really big deal, at least in my mind. That's how I heard it. I went home and did my research on the internet, and I was like, oh my gosh, this is major surgery. He said there's also another option for a it's a specialized doctor, who's like a vaginal rectum kind of guy. I forget the right term, but he's more of the rectum kind
Like a
of,
colorectal surgeon
maybe
or
something like
okay.
that. And he said, so he could do the repair, but again, that's like major surgery inside your
Mhm.
rectum. And what,
Yeah.
you think I'm going to be sitting on a bike after that? No,
Yeah.
not a mountain
Right.
bike, not a road bike, like, absolutely not. So I do have a consultation with that doctor, I think in May, but I'm starting the PT, and just like, that my OBGYN never said a word about PT.
Mm.
Not one word. It was only when I went, because I've been going to this same PT guy for like 4 years. I tell him everything. I'm like, so I said, I have this issue. And he's like, oh my gosh, and he told me, the woman that got certified in his shop. And so I'm going to see her tomorrow.
Yeah, that's great. Well, not great about the
Yeah.
lack of education, but great
Uh,
that you're seeing the PT tomorrow. But I hear the story like multiple times a day, honestly. And
uh,
in the doctor's defense, it's like you go there and they're looking for like really insidious things like is there cancer? Is there an infection? Is there whatever? They're not necessarily like assessing the muscle function, but that's where the physical therapist comes in, right? So the gap in care is not so much like lack of knowledge on like the doctor's part. Like I'm certain they're knowledgeable, but it's like a lack of knowledge of options. You know what I mean? So
right.
that's like where the gap needs to be eliminated, in my opinion. But the PTs always have each other's backs, so that's why
Yeah.
that's why that PT was like, you should go there.
Right. And I'm very fortunate that I have great insurance. So
Mm, yeah.
not everyone is as lucky.
Yeah, and um that's the thing too. Sometimes like with pelvic floor, I mean it sounds like you have it like already worked out. But a lot of times insurance doesn't like to cover pelvic floor PT because they deem it cosmetic issues, which it's not ideal.
True,
But
true. But I think that sometimes, depending on how you code it, it can
mm,
get it can get approved. I guess I'll find out, won't I?
no, I mean if you've already
I have the
scheduled
appointment,
the
so I'm
appointment, then
sure
it's
they already
probably
submitted
fine.
it. Yeah.
Right. Yeah, yeah. I personally at my clinic I'm out of network because then I don't have to see like insurance reimbursement has gone down every year since I've been a physical therapist. So that's like I said, almost 8 years
Yeah.
now.
Mm.
So in order to see patients one-on-one for an hour and be able to progress them how I see fit, that's really the only option for me because sometimes reimbursement is as low as like $30, for the hour. So that's
Wow.
not super sustainable. At
Yeah.
least I mean, I'm New Jersey, so
Right. Right.
um, not that it's like great in any state, but that's what it is here. So
Um,
yeah, bummer.
yeah.
Well, yeah, that's just like I'm in mental health, and so that's the same thing, and it's so frustrating because it just like discriminates who can get care too. Right?
Hmm.
It's
Right. Yeah, exactly.
just such a terrible systemic issue.
Yeah, and that's like to the point of like maybe the doctor's visits as well, right? Because they're in insurance, and how many patients are they seeing a day? Like they have 4 minutes with you probably, right?
Yeah.
Um, so they're just really trying to make sure, like I said, there's not any like really insidious issues going on, not necessarily looking at, your quality of life, unfortunately, or the fact that we want to still run and still, cycle or whatever. They just care about what's functional.
Yeah.
So
Yeah.
not them as like a person, but then they care because that's what they have to write in the notes, right?
Right.
So
Right. Yeah. Yeah, I think you hear that a lot in our group with like primary care and stuff there. It's like, oh, you're healthy and exercise, you're good. And you're like, but like all these things don't seem right. Uh,
right, yeah.
yeah. All right. Is there any other questions? I'll ask one more if there's no more. Um, for those of us, aka me, who pee like 100 times before they go to bed at night, I've clearly have taught myself to do that. Um, what is like the way to stop? Just don't do it and hope you can fall asleep.
I have follow-up questions if you don't mind.
Yeah.
Uh, what's your water intake like? And are you like chugging all the water at night because you didn't drink enough water, or are you like spacing it out throughout the day?
No, I would say spacing it out throughout the day, and I work out 90% of the time in the morning. So,
Okay, that's good.
yeah.
How much water are you drinking?
Oh, I couldn't give you an exact amount, but I mean, a water bottle doesn't leave my side. So,
Okay, good. So you're good. I
yeah.
just want to get the like
Yeah.
low-hanging fruit first.
Yeah. Yeah. Yeah.
Um, Usually we tell people to try to cut fluids about an hour or two before bed, if they're having like a specific nighttime issue. But like let's put a number on it versus like a million times. I think you said a million times. So let's
Yeah.
say you're going 5 times in the span of 30 minutes before bed. Is
It's not
that
that many. It's like three
okay?
times.
Okay, 3 times in 30 minutes.
Yeah, like I'll go pee before, like when I'm brushing my teeth and whatever, which I consider the normal time. And then it's
Hmm.
probably twice more before I actually go to sleep. So probably, yeah, 30 to 60 minutes.
Okay, and you're in bed
In
getting up.
bed. And I'm about to
Okay.
fall asleep, and I'm like, I better go pee one more time.
Yeah, I would stop.
Okay.
So let's say if you do have three right now, try to get it down to two. And then one way, like let's say you're lying down and you like feel the urge. I would try to change positions.
Okay.
Sometimes that can help. Also, like taking some of those like deep diaphragmatic breaths can help. Almost like it takes the pelvic floor muscles through their range of motion. So almost like resetting them, and then that can help decrease the urge. But it takes 2 to 3 weeks for your bladder to get used to like a new norm. So it's not going to happen like tomorrow.
Yeah.
Probably take like a few weeks of you trying to cut it down to from 3 to 2 and then from 2 to 1.
Hmm. All right. Give it a whirl.
Yeah. Let me know.
So, so I just have to chime in here because
Uh-huh.
about probably 4 years ago, I started getting up in the middle of the night once or twice to pee very unhappily. Like I I cannot tolerate it because then I have trouble going back to sleep. And so I don't
Hmm.
I need to be like passed out for 7 or 8 hours in order to feel like I got good rest. And when I talked to my OBGYN about it at my annual visit back then, he said, um, that's normal. That's
Hmm.
okay. It's like, no, it's not okay. And that
Right.
wasn't normal before. Oh, that happens to everyone as you get older. I'm like, no. And again, well, first of all, he's a man, so he cannot relate, really.
I love this. You're like fueling my whole presentation. This is great. Thank you. I did not hire you.
Yes. Yeah, I like to do, the dog and pony show too. So yeah, and he clearly wasn't aware of any other,
Mhm.
natural kind of remedies or PT, right? Um,
Mm.
but guess what? I'm going to educate him.
Oh boy.
No, I have been seeing him literally. If I'm 63, I've probably been seeing him for 30 years.
Mhm.
Seriously. And
Yeah.
I have that kind of relationship with him. Like he knows all about my life and everything I do. And he's like, so what are you doing now? Where are you going? What do you like? He knows and he remembers it. Like
That's
and
nice.
and like what I think Hunter said it when like you go to the doctor and they're like, oh great, you exercise, you're good, boom, out you go. And so he's kind of like that too, because I'm sure there aren't that many patients out there that are like us. We're
Mhm.
in the minority. um but that doesn't mean we don't have issues that need to be addressed.
Right. Yeah. So technically 0 to 1 time is considered normal. But and like I said, you said you're 63, so like
Yep.
around perimenopause, menopause, that's when like symptoms are gonna start creeping up and getting worse if they were like kind of dormant before. So that's probably what he meant. However, like I said, there are it's common but not normal. Common meaning it's happening to a lot of us, but there's, you know, um, methods of trying to combat those symptoms. But um, I'd have the same questions like how much water are you drinking throughout the day? Are you like chugging it all in one sitting? Are you trying to space it out throughout the day? Um, that kind of stuff is what I'd ask, which hopefully your pelvic floor therapist will ask tomorrow, right?
Right. Yeah, I'm sure she will. Yeah, I tend to space it out, and I definitely make a conscious effort to stop drinking fluids 1 to 2 hours before I go to bed.
Cool. And then same recommendation then let's say you're doing twice a night, trying to get it down to one. That second time you like wake up with the urge, I'd try like some of those deep breaths, try to change positions, that kind of thing, just to like retrain your bladder. Because it started out as um like you might feel the urgency, but not actually have to go, because technically our kidneys are making a hormone throughout the night where we should be able to sleep through the night without waking up. But if we have pelvic floor dysfunction, we're going to have an earlier onset of urgency frequency. So your pelvic floor dysfunction maybe is, like I said, starting to surface. So that increase that symptom, and now you've uh, accidentally created a habit for your bladder. So now you have to like untrain that habit.
Right. And I'm thinking that about 4 years ago when this all started, that's when my symptoms were becoming more prevalent, and now it turned into this rectocele.
Mhm.
So
Yeah, and the rectocele in itself is going to put pressure on A, the pelvic floor muscles, B, it can also cause constipation, which can put pressure on the bladder and the pelvic floor muscles again.
yep, I have all that.
So,
Perfect. Perfect. Everyone wants to be me.
hey, you're not alone, clearly. So,
Yeah.
Well, good luck with your appointment tomorrow. I hope
Thank
it's
you.
a
Yeah.
step in the right direction
Yeah. Yep.
to avoid surgery.
Oh, yeah, absolutely. And the older you get, the recovery time, it's never the same. You're like, it's just not a good option. So, yep. We have to take care of ourselves and be our own advocates.
yes, unfortunately. Also too, like sometimes I'll see people right after the surgery. Like some doctors will do the surgery and then they'll send them to pelvic PT, which is great. I'd love to see them before the surgery and after the surgery. But some patients aren't recommended to PT at all after the surgery, and I'll see them like 10 years later, and it's like the surgery failed because a prolapse is a pressure management issue.
Yep.
So that means, as you said, with the breathing, that felt totally backwards for you, right? So
Yeah.
let's say you had the surgery, you never learned how to like properly engage the pelvic floor muscles, properly work with your breath, then you just created like the problem again. So then the surgery was kind of for nothing, right? So that's not great.
Right. And exactly what you said about, when we're young girls and we're told, well, pull your stomach in and don't push it out, and we
Mhm.
we're creating issues we didn't even know about.
Yep. Tight legging, high-waisted jeans, high-waisted leggings. Put a lot of pressure on that too.
Oh,
Sorry.
that's all I wear.
I
All I wear is leggings or jeans. Oh my God.
know. Sorry.
Oh, well, we could just be naked and then shorts and t-shirts year round, I guess.
Yeah. Have to move from the Northeast though, I guess.
Yeah, well, that doesn't work so well here.
No. All right. Is there any other questions before we wrap up?
I was hoping this would be more question answers versus just me talking.
Okay.
But yeah, I had a good time. Thank you guys.
We
Thank
appreciate
you
it. One
so
last
very much.
question. If people want to work with you, what's the best way to get a hold of you?
Instagram for
Okay.
sure. Um, I can like type it in the chat,
All
maybe.
right.
Oh,
Because I'll
there's
put
the
it in
chat.
our next newsletter.
Okay. Um, Ascension Pelvic is my Instagram, which I'll put my email on there as well. And then the website, ascensionpelvic.com.
All right. Perfect.
And I'm happy just to chat too. I can talk about this all day, just like we did now. If your pelvic floor appointment doesn't go as well, just let
Yes.
me know.
Yeah,
And I'll talk you off the
I
ledge.
definitely will. Thank you so very much for all of this great
No
information.
problem.
And thank you, Hunter, for,
Yeah,
organizing this for us.
you're welcome.
This is actually my first WOW event. I joined last year, but I just haven't been able,
It's
the
all
timing
good.
just hasn't worked out. And this one, the timing worked and the
Perfect.
is so,
Perfect.
so relevant. So
Well,
thank
I'm glad you joined.
you. Yeah.
All right, everyone. Thank you, Amy. I'll put your info in our newsletter and enjoy the rest of your evening.
Yeah, it was fun.
Yeah.
Thank you.
All
Nice to
right.
meet you guys.
Have a great night.
Yep.
Bye.
Bye.